to the Healthcare Planning and Infrastructure Expo Conference 2025.
Now, our next session focuses on the true backbone of healthcare system nursing, presenting nursing excellence as the backbone of healthcare infrastructure, strategies for empowerment, retention, and systematic integration. The moderator of the panel will be Ajitabh Alwin Thomas, AGM, Nursing Quality, Max Healthcare. Dr. Professor S.N. Khanna, Chairman, Adult Cardiac Surgery, Artemis Hospital. Please welcome him up on the stage with a big round of applause, everyone. Dr. Meenu Bajpai, HOD, Pediatric Surgeon, AIMS and Yashoda Medocity. Dr. Professor Rajesh C. Shah, Professor and Medical Superintendent, NM Medical College. Colonel Dr. Sajal Sen, CEO, IIT Guwahati Healthcare Foundation. Please join me in welcoming all the panelists upon the stage with a big round of applause, everyone. I request Ajitabh sir to take over.
A very good afternoon and namaskar to everyone. And on behalf of Max Healthcare, I wish you a wonderful day today. And it's a real pleasure and honor to be here in your midst and welcome the panel discussion on a very important and really interesting topic, that is nursing excellence as the backbone of healthcare and infrastructure. I, Ajitabh, congratulate Healthcare Planning Infrastructure Expo for organizing this panel discussion and really important topic which is important for all the healthcare institutions at the moment. And I take this privilege to moderate the session with amazing panelists. So may I request everyone to give a big round of applause for all the panelists here for taking out the time from the busy schedule and being here. Across the globe, nurses from the largest components of the healthcare workforce. They are the first point of care, the critical support in crisis, and offer the last confronting presence in the time of patient's need. And yet, the conversation around the system design, policy reforms, and healthcare innovation often sidelines the very important group and ensures this system function very fast and very apt. So today in the discussion is centered about the three powerful pillars here, and we have three components that we'll be discussing and you guys will be talking about those components. One is the nursing empowerment, one is the retention, and the systemic integration in nursing as a healthcare system. Our esteemed panelist brings a diverse range of insight from their clinical leadership and academic researches and the policy development. And I congratulate everybody to be here. So I would like to call upon, since Dr. Bansal is not around, so we have Dr. Professor S.N. Khanna, Meenu Bajpai, Dr. Sajal Shah, and Dr. Rajesh Shah. Thank you so much, sir, for accepting the request for being a panelist. So let's welcome and start with the panel discussion. So my first question goes to Dr. S.N. Khanna. Sir, we are going to talk upon empowerment, and I would like to understand from you, with your experience, what does the true empowerment look like for the nurses in different level of healthcare delivery system? If I say from bedside to the boardroom.
Well, afternoon everybody, and I would like to thank to be a part of the privileged panel here. I think the nursing empowerment is pivotal in the care of the patient in the healthcare system. And I have been in cardiac surgery for last over 30 years and have had a chance to work with best and the most dedicated nurses at CMC Vellore, at KEM Bombay, at Escorts Heart Institute for 26 years, and at RTMS Hospital, Gurgaon. And I would like to say honestly that nurses have been a part who made my bad days good and my good days better. So they are pivotal. And in empowerment, why is it important at the first stage? So if we empower it, many studies have shown that the mortality is decreased in the patient, and the patient care improves. And I mean, there is a high, morale in the like, nurses, attrition like, rate is low, and the healthcare, delivery is, obviously better. If we move towards the empowerment, I think the basic thing is the nursing education. In nursing education, what they had read 5 years back is long outdated. And we have to keep them abreast. With the CMEs and simulation models and everything. The second aspect of education, it goes is if they take part in the leadership program in the many decision-making bodies of the hospitals, it would encourage them. So in fact, we have to be able to view the role of nursing in a different perspective other than just a staff to center of the healthcare. And the most important thing, the nursing are the bridging gap between the technology, doctor and the patient. So if the nursing care is effective, automatically the delivery of the health, it would be better imparted in any hospital. And I think if we leave the nurses to take the care of the patients on the floor, if we risk their lives with them, they should obviously be a part of decision making also. Absolutely. On the table.
True.
And therefore, I think it is not only important, but it is it is an important investment for all the hospitals to uplift the empowerment of the nursing.
Right. Thank you so much, Dr. Khanna. And I think so you've already answered my second question, which was about how education can actually help in empowering nurses. So Dr. Khanna has actually given a powerful insight about nursing empowerment. And sir, you have reminded us that nursing empowerment goes beyond acknowledgement. And you actually mentioned that the fostering leadership and ensuring access to leadership skills and ongoing education for nurses actually help them out to become a more eminent and prompt leader in the healthcare system. So we have Dr. Sajal with us. Dr. Sajal, since you are from the government setup, I would like to impose the same question. However, the setting would be different. So sir has given his perspective from the corporate or a healthcare perspective. How about the nursing empowerment in government setup from bedside to boardroom scenario?
No, it's not only restricted to government setup. What I think we discussed, and I feel that when we talk about empowerment, we also talk about a career mobility and an upward graduation from different levels. In the current day, we have nurses who are for 30 years who are in clinical domain working in some ward or some department and suddenly promoted to the head of nursing with very weak administrative acumen. On the other hand, there are people who have been in OPD areas or procedure room for years together, and suddenly at one point they are become the ANS or DNS of a complex cardiac surgery unit where they don't know. With technology, I think the entire country has to decide, private as well as government, more on the private side. In a corporate setup, I think you need to have two different streams. You develop a nurse from a staff nurse level to a senior level within the ambit of the clinical nursing. And at the same time, parallelly, you develop an administrative nurse manager from a nurse executive to the chief of nursing. And both of them have to be given an equal importance. Until unless these two streams are, separately groomed and empowered to do things which they are expected to do with the right kind of skill set, nothing is going to work. This is my major, and that would be the solution to Professor Khanna's problem also, that if you need to have more people to be specific to task, you need to have them retained in the same stream for years together, rather than making a good experienced nurse a bad administrator at some later stage, number one. Number two is that in public health system, as I come to, I think the time has come, you as many doctors you create, as many MBBS you produce, I mean, the state of Assam, where I'm currently working, we have graduated from 5 to 23 medical colleges. But end of the day, I think the doctors to population ratio will remain skewed, and we will have to empower nurses for a large number of things. Already it is happening that the A&Ms and the health and wellness centers have been redesignated as a community health officer, and the nurse is given the right kind of empowerment to at least suspect and at least partially follow up and treat the chronic diseases like diabetes and hypertension. One, it had been confirmed and treated by a physician. So I think those kind of peripheral investments have to be made in the nurses to make them better qualified in their skill set, and complement the role of the doctors with a role shifting, so that the doctors can do bigger things and the nurses can take on the direct community connect. That would be the stream which will ultimately work together. To summarize in 2 sentences, we need to have 2 streams, the clinical and admin streams right from beginning in hospitals, and we need to classify them and make them grow together, pay them well and retain them. And the second is, in the community system, we need to empower the peripheral nurses to do things and do a task shifting from the doctors to the nurses. These are the 2 things which will do that.
Thank you so much, Dr. Sajal Sen. So, I'll be posing another question to you only, sir. This is on systemic integration about nursing into administrative roles. So, in what ways can nurse be better integrated into decision-making process at the policy and administrative level? So,
you see, as I said, that they need to be trained towards management. Like we have been trained towards management, they need to be trained towards management. That is number 1 thing. And secondly, each and every decision with the clinical system in a hospital takes, I find that most of the time the boardroom decisions are made without taking cognizance of the grassroots realities, where the inputs you get maximally for nurses, and most of the interventions fail. So it is time that we make sure that whenever there are some critical patient care decisions, the nurses have to be involved. Their short groups have to have a discussion and they should have a voice. And before you implement, I think their buy-in has to be taken. That is one way to ensure that your clinical services are par excellence, and your doctors both are satisfied by the administrative intervention which you do in a hospital.
thank you, Dr. Sajal. And for this insightful reflection, what clearly emerges that it's a systemic integration of nursing leadership is not just a matter of inclusion. It is something which is strategic imperative of building the nursing resilient. So that's really important. Thank you so much for giving your insight upon this, and truly appreciate your vision upon nursing as a backbone and nursing excellence. I come to Dr. Bajpai. Dr. Bajpai, if you could implement on one systemic change tomorrow to uplift nursing excellence, what it would be and why?
Pasta Madam for asking me to come here. I've been a medical educator at All India Institute. I was dean there. I'm a pediatric surgeon, and now I'm as a pediatric surgeon at Upasana Medicity as well. So you can understand that all these years, my work without good nursing support would
Absolutely,
not have.
sir.
And I'm a pediatric surgeon, so you can imagine the amount of respect that I have, and also the thoughts that I have, how we can improvise upon it. First of all, I would like to just carry on from where Professor Khanna and Colonel Sen had gone. Actually, they have touched various aspects, and I would stitch them together.
Right.
To look at 3 components which should be integral when we try to see that the nurses come to the fore. That is education, giving them a decision-making mandate, and you mentioned often that how in the boardroom they can play a role.
Right.
So education, imagine what our targets are. We are going towards nurse practitioners. Now, that concept has been there in Switzerland for many, many years. In the US, it is coming up very rapidly. In our country, we feel that also. Our country is short of specialists to the tune of 15 lakh specialists. This is Lok Sabha figure.
Right.
You can imagine, and we are able to produce 72,000 PGs every year only. National Board of Examination, which I represent, is doing a lot, and very soon we will find about 2 to 2.5 lakh PGs every year. That program I'm not going to dwell upon right now.
That's really
But imagine, till that happens, who is going to handhold the patient and the doctors? It is the nurses. So therefore, nurses education, we have to look at, and now we are training them into various subspecialties also. Look at where medicine and surgery has gone. lot of subspecialties. There are nurses which are trained into cardiothoracic alone, then pediatrics, neonatal nurses, the antenatal, and etc. So therefore, I would like to see that it has to be trifold. Their education should be very, very robust, and we should focus upon that, how we can improvise upon that. It is happening, but we can make it more structured and systemic. Therefore, the Nursing Council of India can come, and which are active. They are doing a lot of work, but I'm sure we can get them on board as well. As far as the decision-making mandate part is concerned, as Dr. Colonel Sen mentioned just now, we have to involve them in day-to-day activity.
Absolutely.
So when we have our meetings, we should make sure that the nurses are part of those meetings. These meetings being administrative, the patient distribution, the triage, etc., etc. If they are part of our system, which in many hospitals they are, they would be involved. As they grow up in their stature and experience, they will become senior people to tell a thing or two to us also.
True.
That number 3 is the recommendation. As nurses cadre go up, the boardroom representation would be that of senior nurses. And imagine with this education and this kind of exposure, if they have gone through the ranks, they would be there to tell what is good for the patient care, what is good for the hospital, and what is good for the nurses training as well. So I think involving them in what we involve our doctors for is the way, it's the only thing that is going to help us.
Thank you so much, Dr. Bajpai, for the great insight. I believe the moment as India is booming up with healthcare industry and the moment we are getting into more of international marketing coming in, so the major responsibility of the outcomes lie upon the nursing care. I believe around 60 to 70% the outcomes are based out of nursing. So if we do not empower them and we do not have the right education system or upskilling and upstanding them, that will be really need of an hour. Thank you so much, Dr. Bajpai. I'll come to Dr. Rajesh Shah, sir. Sir, recently we have observed that there is a great drift of nurses moving out of the country. They are moving to western side and to Australia and New Zealand for the better approach and better salaries and everything. What is retention plan for nurses? So I would like to pose a question that what are the most effective strategies you've seen or implemented to improve the retention, especially when it comes to high stress environment for nurses?
Thank you, Ajitabh ji. Very, very relevant and important questions. Good hospital owner is available, Madam Upasna ji, and retention of any of the staff members is the crucial problem for any organization. And we consider the criteria. If an organization is able to consider at least 80% retainment every year, it is one of the best retainment for the incident. And I would put one proverb.
I think so that will be like a dream come true.
Yeah. So, one proverb is there, it is better to have a known devil rather than an unknown angel. So, we know the capacity of the person, we know the activity of the person, and that's why to retaining is a very, very difficult task at present. I would narrate one problem which we faced as a medical superintendent. It is a 850-bed hospital at Ahmedabad, affiliated with the Narendra Modi Medical College, and the hospital is known as LG Hospital. There was one sudden incident in 2016, and the incident was a one-day operation theatre. 4 patients were operated for different eye surgeries, and all the 4 met with the blindness. On the next day, it was found that all the 4 met with the blindness. I was not at that time superintendent of that hospital. I was heading the other corporation hospital. There was a big hangama, you know. Nowadays, the social media and everything is playing a very big role.
It's like a fire in the forest. It goes like.
So suddenly they made a decision that I should take over that, being a qualified double postgraduate surgery and gynec, as well as a law and medical administration. I was shifted immediately to that hospital. Now it was an open playground for me also, because it is absolutely a new and fresh ground.
Right.
But under that circumstances, the first meeting I called, because I personally feel that there are 4 pillars for the healthcare building. And though one important pillar is not doctor, initially it comes number 1, but nursing is the immediately come number 2. And this is also an important pillar for a healthcare. So immediately rushing to the hospital, I immediately called. They were crying with the tears. It was very difficult task to manage. But your communication, your words of sympathy are very important at that time. And that was very much required. we assured them, another part of the requirement is the assurance. We assured them the full safety if they continue to work, because nobody was willing. There was a nearly strike for the nursing staff, that nobody was willing to work in the ophthalmological operation theatre. These were the situations we have provided the assurance. We have to create few temptation for the people, work in that environment, and ultimately we were able to solve the problem. But this is an important message, that retention with all this assurance and giving them the full communication support and assurance of the safety. This is very important task. Another important, I give you a message 1 week only. There was a big incident in Navsari, a district in the Gujarat. And in that hospital, there was a sudden death. The patient was an orthopedic problem and was admitted for a surgery. The orthopedic surgeon has not touched the patient because during primary anesthesia phase, the injection was given and there was some lacunae which we cannot discuss here. But in that lacunae, the patient died immediately. And that circumstances, there was a FIR launched against the nursing staff. So this is another important issue regarding the nursing staff. And in FIR, the nursing staff was involved in a way because it was their responsibility also to look after, as Minu has rightly said, it is the link between the patient and the doctor. So they are supposed to see after, and being a qualified nurse, they were supposed to look after all the medicines and whatever injections are being injected, they are supposed to, and they were also taken to the custody.
Thank you so much. I think so Dr. Bajpai wanted to add something to that.
I want to give a just the quick point on. I'm motivated by his examples day to day. Only yesterday, as you know that our Yashoda Hospital is super specialty, has been around for almost 2 decades and doing very well. We have got a Yashoda Medicity now, which is coming up very fast. Within this end of this month or early next month, we'll launch it. But there are a couple of things to be tied up when you are in that stage. After we took the round of the mother and child block, I realized that ICU, PICU, NICU, nursery, labor room, etc., which are all part of that system, I need to wrap up a few things. I quickly thought that let us ask the nurses which are going to be deputed in that area to be in charge immediately. So I asked the HR head, and in fact, Dr. P. Narola was there. I requested him, and he said immediately do the same thing. So we put up one person for PICU, NICU, and said, you will coordinate what is happening, whether the vinyl flooring is complete or not, whether the ceiling is being done or not, whether air conditioners, the ventilators are put or not, you coordinate. So they will be working in that PICU or not NICU, and they will be there to see and responsible and feel accountable. Imagine this is empowerment. They feel part of it. They will see to it that things are done. They will be informers to us and a liaison between us and the industry which is doing it for us. So I think that is involvement in day-to-day activity. They feel confident, they contribute, they are the ones which are equal stakeholders.
Absolutely.
That feeling is extremely important. Thank you very much.
Thank you so much, Dr. Bajpai. I think so Dr. Rajesh has given a very apt and very relevant example of an ophthalmic surgeries and the cases. And adding on to Dr. Bajpai's point that empowerment and involving the nurses into day-to-day routine work gives them more of feeling like we are the part of the team, and that makes it more of a family. So with this, I'll again come back to Dr. Shah. So, since you have talked about one of the example and you have also made certain changes in the system in order to have a better work environment. So, I would like to pose a question to you that how we can redesign work environment to address burnout and enhance job satisfaction for nurses.
The first thing we have to do is the communication. Proper, detailed and informed communication plays a big role in such situation. Another is motivation of the people. The mentorship from the higher staff to the below grade staffs is very important in that, because mentorship is an important stage where this can be helpful.
Thank you so much, sir. All right. So, thank you, Dr. Shah, for this thoughtful experience and the right insight about the meaning of empowering nurses through mentorship, being motivated, and we should become the coaches for them, so that we should not be the teachers to guide them or tell them. We should rather help with them and work with them in order to have a better environment. I'll with this, I'll come back to Dr. S. and Khanna once again. Sir, I have another question for you regarding empowerment. As you already mentioned the point upon educating nurses, because I feel that since the medical team is already super specialized into their areas and specifications, and the nurses equally support them during the patient care. So why can't we also have certain super specialty programs for nurses, those who can support and equally complement the medical system into the departments?
Yeah, I think that is extremely this pertinent, relevant thing. We should, Professor Bajpai had stated that they should be a part in everything, in fact, decision making, more responsibility, and we should educate them. And also, yes, why not, they can be, super specialized in the areas of their interest. So that's how the mentorship is extremely important in a particular nurse. We have to recognize their talents, and in that area we can groom them, encourage them. And as far as decrease the attrition rate, we also the hospital has the responsibility towards taking care of them in terms of their financial assistance and other timings and everything. And I feel that if they are a part of all inclusive responsibilities, they definitely would be interested in further educations. And it's a time that we should devise such a strategy.
Absolutely. Thank you so much, sir. So out of the conversation that I had it with you, sir, I believe that empowerment is not rightly emphasized. It is not just a gesture, it is something like a structural commitment that has to be done with the nurses. And from bedside to boardroom, empowerment means equipping the nurses with the right voice to lead. That would definitely help them out to sustain and grow in the system and complement the medical team appropriately. So with this, I'll come to my another question, which is for Dr. Sen. Sir, since we were talking about the voice to lead, and in fact the Nurses International theme also talks about nurses are future, voice to lead. So how can we ensure that nursing voices are heard and valued in the design and implementation of healthcare structure?
Thank you. That's a good question. I think the first and foremost thing, as I earlier said, that you got to develop a structure, got to develop a growth path for the individual skill sets on the nurse managerial side and nurse clinical side. And then in the clinical side, as Professor Khanna wants that we say that we need to go for super specialty program, I think Nursing Council has to look into them. They have some post-basic programs already.
Yes, they do have.
But they need to look at them more specifically to enhance the skill set so that they can support these programs very well. No doubt about it. Now the second part is that how do you exactly integrate them into the system? That is your question.
Right.
And how can you make their voice relevant? As I said, that once you make a structure and once you put them in the managerial system and then allow them to transgress into the territory of the management of the hospital and management of the nursing care, you can fudge those lines, you will find things become very relevant. I'll be very happy to say that when a hospital administrator is away on leave, the nurse manager leads the hospital. I think that is the ideal situation which should happen, because that is where we have seen pandemic, we have seen COVID, the resilience of the hospital system was largely dependent who has got how many nurses on duty. This is so simple. And it was the leaders in the nursing system. I have been running hospitals. I was those days heading few Apollo hospitals, and we found that we are dependent on the nurse leader. If the leader could provide her the right kind of staffing, she could only do it, not me. So I think there are times that you need to understand and one has to transgress these two systems. And lastly, I think when it comes to quality, patient care, safety, I think all these subjects, they largely depend on how efficient your nursing care is. So therefore, every time you delve into these administrative topics, instead of having a managerial input, I think you need to have the nurses to voice them. And that is where you will get the best input. If you want them to be trained somewhere, you train them somewhere. But that is how it is. So ultimately, one last recommendation I make. I have seen all weathers, many summers in the management of hospitals, and I think that we are still not doing right. We are still very grossly underpaying the nurses. We need to look at their salary structure and see that we remunerate them well as per talent and responsibilities so that we can retain them. That is the major thing, and there is so much of discrepancy between various hospitals what they are paying. Therefore, it becomes a problem and people lose their talent and bulk. We need to look at it as a consortium of hospital and decide that what should be the actual salary of nurses. That is something which we have never bothered to look at. Thank you very much.
Thank you, Dr. San. Thank you, Dr. San, for this wonderful insight. I think so truly embedded nurses' voice in decision making. We must move beyond and took representation from nurses from different structural empowerment, and overcoming these challenges demand deliberate actions. That is from all the leaders that sitting on the dais and off the dais. And with this, I'll come to the last question. I would like to pose this question to Dr. Bajpai. Dr. Bajpai, since you have been handling National Board of Education for Medical Sciences also, what role does continue education plays in empowering nurses, and how can we assist to improve it?
So there's an analogous situation between the National Board of Examination in Medical Sciences, which is actually for the doctors for PG education. But for Nursing Council, it would not be different. I would tell you that the National Education Policy of 2017, which has been further augmented in 2024, which was by Dr. Kasturi Rangan of Bangalore fame, the policy says that at every level of education, part of the exposure of the students after class 12 should be in sciences as a whole.
Absolutely.
So a time would come, it may not be a ripe time today, when after 2 years, somebody who has gone for nurses training but has an adequate similar exposure of medical training also can move laterally into MBBS also. Imagine the enhancement of the education platform in science for medical treatment, whether it is doctor or nurses, should be common and robust. Right. That's national education policy. This is part of the policy. This has some sort of glitches in implementation because we don't have a uniform system in our country as of now. But the fact that the policy is there, people are working, the government is working in that direction. So one, yes, our fundamental education should be very strong. That's none. Second thing that you asked, and Professor Khanna very aptly answered that, was the nurse specialist. Nurse specialist training is going on. As I mentioned, an example of nurses which are trained into cardiothoracic or pediatric or for that matter renal disease, etc. Nurse specialist training can only not only be in the clinics alone, that can be backed by enough material also, the curriculum also. So Nurses Council of India should be part of our meetings next time. We can, and I'm sure they must be doing something.
I'm ignorant. Representation there.
Oh yes, so you would know. You would know. So I may be ignorant about it. I'm sure they would be doing it. I could see at All India Institute of Medical Sciences and in Yashoda, we make sure that the nurses are involved in the teaching programs. We call them, our talks are attended by whoever can come. So I think involving them in the education and specialist areas would go a long way in teaching them. So education cannot be ignored at all.
Absolutely. Yeah. Thank you so much, sir. So I believe the leadership of the country need to look forward for more enhancing and enriching programs for nursing programs, and also have into more of policy engagements. So with this, we come to the end of this panel discussion. I believe it is a very interesting and insightful discussions by all the extreme expertise from the field. So let us take these lessons forward in collective commitment to elevate nursing excellence every level of our healthcare infrastructure. So as we draw this enriching decision or discussion to close, and one standard abundant clear that nursing excellence is not just a support system, it is a foundation upon which resilient, compassionate and effective healthcare system is to be built. So with this, I conclude, and I thank all the distinguished panelists to be here and sharing your thought upon the nursing excellence. Congratulations to you. Thank you. Thank you, everyone.
A heartfelt thank you to all the panelists for spotlighting nursing leadership and excellence. So I would like to request Dr. Upasana ma'am to come upon the stage and felicitate the panelists. Please join me in welcoming Upasana ma'am with a big round of applause, everyone. Dr. Meenu Bajpai, HOD Pediatric Surgeon, AIMS and Yashoda Medicity. Ajitabh Alwin Thomas, AGM, Nursing Quality, Max Healthcare. Dr. Professor S.N. Khanna, Chairman, Adult Pediatric, Artemis Hospital. Please don't stop clapping, everyone. Colonel Dr. Sajal Sen, CEO, IIT Guwahati, Healthcare Foundation. Dr. Professor Rajesh C. Shah, Professor and Medical Superintendent, NM Medical College. I request all the panelists for a group photograph.